ആരോഗ്യ സംരക്ഷണത്തിനായുള്ള വിവരങ്ങളുമായി ഇനി ലൈഫ് ആൻഡ് ഹെൽത്തിൽ റോസ് വടകര.
കോവിഡ് തീവ്രവ്യാപനം തുടരുന്നതിനാൽ അതീവ ജാഗ്രത പാലിക്കുന്ന ഈ അവസരത്തിൽ നിങ്ങൾക്ക് ഏതെങ്കിലും COVID-19 രോഗലക്ഷണങ്ങൾ ഉണ്ടെങ്കിൽ അവ നേരിയതാണെങ്കിൽ പോലും നിങ്ങൾ എത്രയും വേഗം രോഗപരിശോധനയ്ക്ക് വിധേയരാകണം. നേരത്തെയുള്ള രോഗനിർണയത്താൽ നിങ്ങളുടെ സുഹൃത്തുക്കൾക്കും കുടുംബാംഗങ്ങൾക്കും നമ്മുടെ സമൂഹത്തിനും വൈറസ് പടരുന്നതിൽ നിന്ന് ഒഴിവാക്കാം. Today, we will be discussing about the current testing guidelines related to COVID-19, and it is my pleasure to welcome Dr. Mary Barsanthi, who is not only an infectious disease specialist, she is also an internist and pediatrician from Loyola University Medical Center. Welcome, Dr. Mary, to Life and Health.
Thank you so much. Pleasure to be here.
Doctor, we all know that testing and quarantine guidelines could be subjected to change from day to day. If you're COVID positive, what is the current guidelines on isolation and quarantine?
Currently, right now, the CDC recommends that if you have a positive test for COVID, that you remain at home for a minimum of 5 days. As long as you remain asymptomatic or symptoms are near resolution, then it's okay to, if you need to leave your home, but be vigilant about wearing a mask all the time when you're around other people for the next 5 days. And that's different. The previous isolation guidelines were 10 days to be isolated from other people. So the reason they've changed this is because the studies are showing that the majority of COVID transmission occurs 1 to 2 days before symptoms develop and up to 2 to 3 days after. So the time frame for transmission of COVID, we have found out, is shorter than for the majority of transmissions. So that's a decrease of isolation time. Quarantine is when you're exposed to somebody who is COVID positive. You are not COVID positive, but you have been exposed. And that time for quarantine is based upon your vaccination status. If you're vaccinated and you have the recommended boosters, then it's recommended just to wear a mask for 10 days when you're around other people. And if you have ability to test, you could test at about 5 days after that exposure. If you are not fully vaccinated, you haven't not vaccinated at all or haven't gotten the boosters, then it's recommended to stay at home for 5 days. And then if possible, test at 5 days. And then for the next 5 days to wear a mask around other people.
Since the pandemic, if we have a sore throat or running nose, obviously we all want to get tested for COVID. Currently, there is different testing kits available in our market. What kind of tests are these and are they reliable?
Sure. So the gold standard for tests right now is a PCR test. And there's some different ways of doing PCR tests, whether it is saliva or a swab in the nose, everybody's heard about. But that is the gold standard because it has fewer false negatives than an alternative, which we all know about, are rapid antigen testing. So the PCR, if it's done correctly, it's a very good test and again has fewer false negatives, which is very important, of course, in a pandemic, and we're trying to prevent transmission.
Just now we discussed about the confirmation of COVID test. After becoming COVID positive and before returning back to work, which test will be recommended? And is it a PCR testing or antigen testing?
So officially, the CDC doesn't say that you need to retest again if you're following the isolation guidelines that they give. However, some places of work and some people would feel more comfortable to do a follow-up test, and that's reasonable. If you do that, it's recommended to do an antigen test because that antigen test is detecting proteins in the virus, and those over time diminish enough that the antigen test can turn negative if you cannot transmit the virus. So antigen test would be the answer to that if you do want to test before going back to work.
Dr. Mary, someone who has identified as COVID positive after their isolation, if they want to travel abroad, they definitely need a testing done, and some airlines recommend PCR. In that situation, what is the best time to do a PCR test?
Yeah, so if you are traveling, you really have to go by the guidance that the airlines need, and also, of course, the State Department through for the country, what's the requirement. So PCR tests can, for some people, remain positive for a long period of time. So if you have had COVID recently, then I would wait until as long as possible. I think most airlines say you should do it, within 24 or 48 hours before travel. So you'd want to wait as long as possible if it has to be a PCR test. Some airlines are okay with doing antigen tests. If you have had COVID recently, an infection with COVID, then an antigen test, if it's acceptable, would be a better test to do before plane travel. According to CDC and a lot of officially through the United States, coming back into the United States after overseas travel, they do accept both antigen and PCR tests, so you could do either. In the case of somebody that's had a recent COVID infection, then definitely antigen tests would be better to do. There are exceptions too. If you have had COVID within actually the last 90 days, airlines and the government do allow you to have documentation of that positive COVID test and a letter from your medical provider. So in that letter, they can give the information about when you were positive, as long as it's been within 90 days, and that if you fully recovered, then that is also acceptable.
കോവിഡ് ടെസ്റ്റിംഗ് ഗൈഡ്ലൈൻസിനെ പറ്റി നൽകിയ വിവരങ്ങൾ ഏവർക്കും ഉപകാരപ്പെട്ടു എന്ന് പ്രതീക്ഷിക്കുന്നു. വീണ്ടും കാണാം അടുത്തയാഴ്ച മറ്റൊരു വിഷയവുമായി. Thank you, Dr. Mary, for your time with us on Life and Health.
Thank you. It's a pleasure to be here.
Namaskaram. Attorney Steve Crifase here. Greetings to the Malayali community and blessings during these challenging times. We understand the unique character of the Kerala community, and we are here to serve your legal needs for all injuries, accident, and wrongful death cases. Call us when you need help. All consultations are confidential. Namaste.
Hello, my name is Jeremy Karedan, here with Citywide Mortgage, servicing Illinois and now Florida. We're committed to serve our community, and we deliver what we promise. Call us today.